Welcome everybody to this Aracy UNICEF joint webinar. My name is Paul Kinderman and I am from Aracy. I just want to start by running you through some quick housekeeping so that you can enjoy the webinar, and then I'll hand over to Penny Dakin and we'll get underway. So just so that you can use the GoToWebinar software, on the right of your screen, you should be able to see the GoToWebinar control panel. By clicking the orange arrow or the arrow in the orange box, you can open and close the control panel to either see more of the presentation on screen or access webinar features in different panels. The audio panel lets you choose how to listen to the webinar and test your audio settings. If you have any audio issues during the webinar, you can switch, for example, to listen by phone using a dial-in number and PIN. Select Australia as the country to get the right details. Finally, the questions panel. The audience will be muted, but you can ask questions at any time by typing them in this panel. We'll be getting to your questions during a Q&A session towards the end of the webinar. Today's webinar is also being recorded and we'll be making that available hopefully later this week. Please keep an eye on our member newsletter that comes out every Friday for details. And now I'd like to hand you over to Aracy CEO Penny Dakin.
Good afternoon, everybody, and welcome, and thank you, Paul. Before we go any further with this afternoon's webinar, I would like to acknowledge that I come to you from the lands of the Ngunnawal people. They are the traditional custodians of this land, and I want to pay my respects to their elders past, present and emerging, and want to acknowledge any Indigenous colleagues who've joined us on today's webinar. Today's webinar is entitled Kids at the Crossroads, Evidence and Policy to Help Mitigate the Effects of COVID-19. It takes its name from a report that we jointly developed with UNICEF Australia and launched earlier this year. In that report, we propose to our national leaders policies they can deliver to help children and young people overcome the full range of impacts they're experiencing from COVID-19. Using Aracy's NEST wellbeing framework, the report presents the evidence of the impacts that COVID-19 has had on young people in this country, and proposes policies based on the evidence of what works. Today, we'll be discussing the report, and we have joining us Nicole Breeze, Director of Australian Programs at UNICEF Australia. Nicole has significant experience in leadership and management roles in not-for-profit organisations in Australia and internationally. This includes senior roles with Oxfam Australia, including leading Oxfam's International Youth Partnership Initiative across 90 countries. Nicole chaired Oxfam International's Program Governance Group for South Asia during an intensive period of change, with the responsibility of establishing a single strategy and operating model in each country of the region. She was central to transformational change project Oxfam 2020, to enhance Oxfam's impact, relevance, legitimacy and sustainability. Nicole has also worked on the Africa Program Desk in Caritas Australia and for the Edmund Rice Centre for Justice and Community Education on Young Youth Engagement and Education Programs, and on social justice campaigns to promote the rights of Aboriginal and Torres Strait Islander people and asylum seekers. With that amazing background, I want to welcome you, Nicole, and I'm absolutely thrilled to have you as a partner with Aracy and for us to be jointly presenting the information from Kids at the Crossroads this afternoon. So welcome, Nicole.
Thanks so much, Penny, and good afternoon, everybody. Thank you so much for choosing to spend your lunch with Penny and myself, and I hope this is going to be an interesting conversation. I'd like to acknowledge that I'm coming to you this afternoon from the lands of the Gadigal people of the Eora Nation, and I pay my respect to the elders past, present and future. It's such a fantastic place to live on Gadigal land, and I'm especially grateful for the ongoing wisdom and knowledge that is shared by the elders in our community, particularly with our children. And I know that my children in our local public school benefit so much from that rich exchange of knowledge. And I know that if that respectful dialogue can continue, led by children, that's setting us up for a better course for the future. Just bear with me just for a moment while I just try and get my slides up and get started in our presentation. Actually, I might just ask you, Paul, I'm having trouble getting my slides up. So if you could drive the slides from your side, I'll let you know when to change them, if that's okay. Okay, so as Penny said, the focus of our conversation this afternoon is the Kids at the Crossroads work that ARACI and UNICEF Australia did jointly and continue to be doing, which is all about evidence and policy to help mitigate the effects of COVID-19. You can see that I've kind of put up at this front slide an excerpt from the United Nations Sustainable Development Group from its policy brief last April at the outset of the pandemic. Children are not the face of this pandemic, but they risk being amongst its biggest victims. All children of all ages and in all countries are being affected, in particular by the socioeconomic impacts. This is a universal crisis, and for some children, the impact will be lifelong. It was very much these sentiments that were strong in our minds at the beginning of the pandemic last year that set us off on the course of the creation of the Knowledge Acceleration Hub. And I think that unfortunately, these words from the UN Sustainable Development Group are proving to be very true. Paul, if you could just change the slide, that would be great. Oh, actually, I'm controlling it myself. How wonderful is that? As I'd also just like to, as Penny said, this has been a really strong collaboration between ARACI and UNICEF Australia. I'd like to, in particular, acknowledge the work of colleagues in the ARACI team. So the wonderful Diana Harris, Sadhna Seramalu, our host with the most, Penny Dakin, and also Kate Solis for the work that they've done in this creation of this collaboration. Very much the intellectual leadership for this initiative has come from the amazing team at ARACI, and it's been a wonderful collaboration to be working on together. I'll give a bit of a health warning in that I am not an expert in these issues, and that there's been smarter minds than mine pulling this research together month by month. But what I'm here to do this afternoon is to help reflect back to you the fruits of this collaboration in the hope that it's going to spark an interesting conversation. So I would really encourage you to please share your comments, share your questions in the chat box. And once I've had a chance to walk you through this, then we'll pick up those and have a conversation. Paul, could we go to the next?
Sorry.
Yep.
You're there, Nicole. It's Paul.
Yeah,
we just can't see your slides. So if you can take over as presenter again, there should be a little box on you. There we go. Lovely. Thank you.
All right, you can see that. Okay, thanks, Paul. Sorry, guys. Yeah, Paul. And again, I'm having trouble actually shifting those slides. So I'm going to just need you to flick them forward for me if that's possible.
Okay. I'll have to take control again, so bear with me. My screen. Sorry, everyone. this was all working earlier in the day. There we go.
Just did it.
Yep, we're now on the acknowledgement slide, and next slide after that.
Next slide, please. Yep.
Right. There we go. Structure of today's webinar.
Yeah, beautiful. So just I'll take a bit of time to give you an overview of the work we've done. What is the global picture around the pandemic and children, to introduce to you the Australian Children's Knowledge Acceleration Hub, and to focus in on some of the key findings of this work over its first 6 months. Then importantly, what Penny and I will do is to try and point us forward and identify some of the key threads coming from this work, and to help to frame the conversation around what we see as some of the key building blocks for recovery, which is focused with children and young people at the centre. So next slide, Paul. So thank you. Just wanted to begin briefly by setting the scene in terms of the pandemic and the global picture for children and young people. When we work at UNICEF Australia, we always, as a rule of thumb, try and involve children and young people in any conversation we're having about them. And when that's not possible, I think it's always good to listen to some children and to make sure that we're really anchored in their perspectives. So UNICEF has created this really fantastic video series, which is available online, and it's Lockdown Diaries. So what it does is it really brings forward the experience of kids in lockdown across the world, from the Democratic Republic of Congo through to India, New York City, London, and I'd like to introduce you to Joachim, who's 5 years old, from Cape Town. And if we could just play that short video, it's just a minute or two. Paul, I'm having trouble with the sound on that. I'm not sure if others can hear it or not. I think that I'm going to make an assumption that others are also struggling, unfortunately, to hear the sound there, and I might just press on. It's a shame, and if you do get a chance to have a look at some of these little clips, they're really very insightful in terms of the experience of children everywhere over the last year. So I just come back to those opening words from the United Nations Sustainable Development Group about this is a universal crisis, and for some children, the impact will be lifelong. Some of the stats that you can see on the screen there are taken from the December 2020 Global COVID-19 Situation Report that UNICEF has produced, which is an internal briefing document. Some of the key pieces around the global impact before we turn to this OECD comparison. The pandemic has caused the largest disruption of education in history. It's affected 1.6 billion learners in over 190 countries. Closures of schools have impacted 94% of the world's student population and up to 99% of that population in low and lower middle income countries. Projections show that 7.6 million girls from pre-primary to secondary school are at risk of not returning to school. So if you think about the scale of that disruption to children's learning around the world, that has occurred and continues to occur in many settings, this is a fundamentally challenging scenario. So as well as the disruptions to education globally, as health systems have been overwhelmed, the global coverage of nutrition services to children, adolescents, and women has declined by nearly 40% in 2020. And the numbers of children around the world living in multidimensional poverty, and we know that that means children who lack access to healthcare, education, proper nutrition, or adequate housing, has soared to approximately 1.2 billion in 2020. So that sets the scene that this is indeed a universal crisis, affecting in very stark ways this current generation of children and young people around the world. If we bring this comparison a little bit closer to home in terms of Australia, and ask the question about how are our children and young people travelling in relation to some of our OECD counterparts, I draw your attention to a report that was released by UNICEF in Innocenti last August, which analyses child wellbeing in wealthy countries. And essentially the picture here is that before the COVID-19 pandemic, Australia was faring poorly in overall terms when it comes to child wellbeing compared to other rich countries. So whilst the trajectory of Australia through the pandemic has been comparatively much better than in other country settings in relation to the overall public health response and the social protection measures, it's an uneven picture. And you can see some of these underlying challenges in terms of our outcomes when it comes to child wellbeing compared to some other rich countries. So the interesting dynamic here is that Australia has an enviable national context that's ranked in the top third of this group of high-income countries for its social, environmental, and economic conditions. So you might think, given those conditions, we'd be faring much better in some of these overall outcomes of child wellbeing. And a key explanation for this gap and this apparent contradiction may be in the policies and the leadership environment when it comes to ensuring children and young people's needs are at the centre of the national conversation. So let's go to the next slide, Paul, in which I'd just like to briefly introduce to you the work of the Knowledge Acceleration Hub. So back in March, when the pandemic was just starting to become a reality of our daily lives, UNICEF Australia made two key commitments. The first, that we wanted to listen to children and young people across the country to make sure that we kept our finger on the pulse and that we had a good understanding into what their lived experience was. So we've been able, in the course of the last 12 months or more, or slightly more, we've been able to listen to close to 4,000 children and young people across the country. So alongside the importance of children and young people's lived experience, we knew that we wanted to help play a role in collating, synthesizing and analysing knowledge, research and evidence to ensure that that was placed into the hands of policymakers and practitioners. We knew the ideal partner to do this work with was Eracy, given that their capability in this area. You can see the aims of the hub on the screen to the right, and since that time, we've published 7 monthly digests, and I know the next one is about to be hit sent on. And as well as that, we've produced the Kids at the Crossroads 6-month stocktake report. If we go to the next slide, Paul. This gives, as Penny said, the framework for how we have constructed the work that we've done through the Knowledge Hub, and it brings together Eracy's NEST framework for child wellbeing, which is Australia's established child wellbeing framework, with UNICEF's universal goals for every child. And these universal goals are derived from the Convention on the Rights of the Child. So we've been looking both from the Eracy NEST Child Wellbeing Framework and from the Universal Child Rights Framework to do the analysis through the hub. And the next slide, I'll just give you a quick overview of what some of the key themes are that have been coming through our work over the first 7 digests that we pulled together in the report that Penny spoke about. So you can see under material basics, and I'm sure for people in this webinar, some of these issues will be well understood. We know that the sharp declines we've seen in employment, especially in secure and casual employment, have had a profound effect on families, many of whom were already struggling. Again, we know that there's an absence of focus on family poverty and child wellbeing in the national conversation. And we know that young people, especially young women, are disproportionately affected by unemployment. And we're seeing, unfortunately, higher numbers of children and young people experiencing housing stress and homelessness. We know when it comes to children being safe and protected, the evidence and data is very clear that families are reporting an increase in stress and that, very sadly, there's been an upsurge in family violence. We know that children, on the most part, thank goodness, have been insulated from the worst direct physical effects of the COVID virus, but really it's what we're talking about as the secondary or indirect impacts for children and young people. The evidence around those impacts, again, is very clear coming through the work of the hub. So children and young people expressing fear for the health of their own family members, the impacts of lockdowns, they're feeling the impact of loss of family income in the household and also of increased parental stress. We know the capacity of the mental health system is strained, but we also know that young people have been demonstrating incredible resilience as they've been navigating through these events. We know the learning divide the digital divide has been sharpened, and unfortunately, we've seen both a widening and a deepening of inequality. So those children and young people who were struggling to access their right to a fair chance in life, unfortunately, are falling further behind. And then we've seen greater numbers of children and young people who, before the pandemic, were probably travelling fairly well, become more vulnerable. So that's really a key summary, and if you haven't had a chance to have a look at the Kids at the Crossroads report, I encourage you to pick it up, and we really hope that this work and this synthesis of research and evidence can be useful for you in your day-to-day work. So if we shift across to the next slide, Paul, and start to ask the question about, well, what does all of this mean, and what is the way forward? Looking across all of this, we start to see 4 key building blocks which can help shape the recovery. And I think the first dimension there is really about how do we engage and support young people's participation in the economic recovery. What do we do to safeguard against the widening and deepening of inequality that the evidence is showing us is happening? How do we promote resilience and well-being? And how do we foster citizenship and fight the disempowerment and disengagement that young people themselves are reporting? If I also just come back to the global Innocenti report on the comparisons around child wellbeing across high-income countries, and this challenge thrown out to us in Australia about the lack of correlation between the economic, social and environmental conditions we have at our disposal and the the lack of congruency with then the poorer outcomes across major dimensions of child wellbeing. It throws up again the importance of this strong national focus on children's wellbeing at leadership and policy levels. Those researchers in Innocenti, when they had a closer look at the situation in Australia, really came up with 3 key ideas, and I think they correlate strongly to these building blocks here. The first is we need to ensure that there are decisive measures to reduce child poverty and prevent widening inequalities. Secondly, we need to ensure that we're strengthening the services that cater for children's needs, including making sure that we do make up for the gaps that have been generated by the crisis. So that means getting routine healthcare back on track, including immunisation. It means ensuring mental health support is available for all young people who need it. And it means special focus on ensuring students who have lost their learning are supported to catch up. So that's the global kind of set of ideas about the building blocks, and that links nicely to the 4 key elements that we see as central to the recovery. So if we go to the next slide, Penny spoke about the event we had in Canberra to launch this report, and we had a parliamentary breakfast, which was a really good conversation. It was well attended. We had the Minister for Youth and the Shadow Minister as well. And the stars of the show, of course, were the 2 young people who we had speaking to their lived experience alongside this data and evidence. And they were really keeping the politicians on their toes in relation to the accountability of progress in these areas. We go on to the next page, Paul. I'm just going to very briefly, without reading through every word on the slide, I'm going to just show you a little bit more detail about what we mean by these 4 building blocks. This is the first one here around economic recovery. Hopefully you can still see that. My slides have just changed. Sorry about that. So the economic recovery and some key measures which we see as essential and important around strengthening the systems to support economic recovery. That's around strengthening permanently the social protection measures that support children and family who are experiencing poverty. It's the things which are long talked about in this community, in this sector, about the vital role of increasing access to affordable, quality early education and care. And it's recognising the changes to the labour market and the importance of prioritising additional employment support for young people to engage them and ensure that their opportunities for employment are in place. The next slide, Paul, if recovery building block 2, is again some concrete suggestions around how to protect against the deepening and widening inequalities. I'll just leave them sitting on your screen for a minute. And then these are some of the ideas that we can perhaps pick up in conversation, both in response to your questions. So please do put them into the chat box if you've got them. And Penny and I might pick some of these up in our conversation as well. The third building block is about promoting resilience and mental well-being. And again, some specific suggestions sitting under that recommendation. And then 4, it's about this very important idea about fostering citizenship and fighting disempowerment and disengagement. And when we work with young people at UNICEF Australia, which we do very regularly, this is a core theme. So young Australians are so engaged, so sophisticated, and so passionate about the future of this country, and so willing to be involved in the construction of solutions. However, they are feeling alienated, they're feeling marginalised, and feeling like there are such limited pathways for them to being constructively engaged. So this is something we need to really focus on unlocking, so that we can all benefit from the constructive energy that young people have to bring to bear to helping us move beyond this current situation. Finally, I just wanted to bring into the mix here, as well as those specific 4 building blocks, which link very closely to the knowledge and evidence that have come from the Kids at the Crossroads report. I wanted to just draw everybody's focus to the work that Michael Hogan and Lynn Hatfield Dodds have recently done under the banner of the Every Child Coalition and in partnership with ANZOG. So again, it comes to this question about what is the disjuncture between a very wealthy and environment where we've got the right conditions to ensure that all of our children can fare well, and the gap we're seeing between outcomes for children and young people and their well-being. So Lynn and Michael really sharpen in on these key elements of investment around system strengthening. So from concerted leadership, smarter investment, engaged public and community, stronger workforces, integrated delivery, and how do we continue to put data and evidence and learning to work. I really think this framework is helpful for us as we think about how to strengthen the system around children and young people. And lastly, because I think we should always start and end with the perspectives of children and young people, I just wanted to show you some of the perspectives here and some of the words of the young people who we've been in conversation with over the last year. It feels like limbo. We're living moment to moment. I don't have any aspirations at the moment. I'm struggling to get out of bed and do my work. My hope was really low. So I think we need to recognise that our young people, like all of us, have been through a very intensive period of great stress, anxiety and difficulty. And it comes back to this point about the importance of civic engagement and empowerment. But that's probably a wrap, Paul and Penny, by way of just giving a very brief and very quick overview of the work that we've done together. And I'd love to have a conversation, respond to your questions, comments and ideas, and have a chat with Penny. So back to you, Paul.
Thanks, Nicole. It's Penny. It's awesome to have an opportunity just to have a conversation with you. And thank you for presenting all of that work. And again, I want to acknowledge the amazing contribution of UNICEF Australia to that work. Without you guys, we couldn't have made it happen. And you know, it's one of those pieces of work that I think, you know, we as an organisation are particularly proud of. And it's also a piece of work that we know has been incredibly useful. The feedback we've received from a large number of stakeholders at, you know, a variety of levels, all the way from sort of federal government to state and territory governments and other for-purpose organisations, has been around how useful that this data has been for them. I just want to kick off with a conversation around engagement. I mean, I know, and I can completely, reading through those quotes you had up on that final slide, and it really, it mirrors my own experience. I've got a couple of teenagers, and one of them, I remember really early on in the pandemic, said, I'm a teenager, life's supposed to be fun, this is ruining my entire existence. I mean, she's a bit of a drama queen, so that aside, how in other ways has UNICEF sort of seen this, I guess, disillusionment or struggle that young people have experienced? Because I guess the pandemic is not the only disaster that's befallen a whole heap of young Australians over the last 12 months, you know, even longer. Are there other work that you guys are doing that's actually shown that this is, I guess, one more thing to add on to a pile of already quite dire circumstances?
Yeah, I think it's a good question, Penny, and unfortunately the answer is this isn't a new trend, or it's not something which is just a result of the pandemic. So As you're getting at there, we have worked pretty extensively over the past few years with young people who have been affected, for example, by the prolonged drought across New South Wales. And we've also worked with children and young people across communities affected by the Black Summer bushfires of 2019-2020. And again, the themes are scarily similar in terms of young people who are talking about the impact of the hardships of those events on their families, on themselves, and on their communities. So if you take their case of drought, for example, you're talking about kids who are describing their childhoods as being pretty truncated, really. So from very early in the morning to very late in the evening, they're getting involved with the work on their properties and their farms. So that impacts on their time for learning and studying and their social times. What they're observing are their parents under significant stress and duress, and rather than adding to the burden of their parents by having a conversation about how they're travelling with mum and dad, they're bottling up their own feelings and emotions. And this is really leading to, if you look at the data and the evidence that we capture in the work that we're doing, these are the stories that inform that experience. So that's why we've got increasing numbers of young people experiencing really significant challenges to their mental health and well-being. And coming back to your question about empowerment and engagement, I think absolutely what they're articulating is we don't know how to engage. We don't know how to contribute. We feel shut out. We feel locked out, and we don't feel any avenue to be constructively heard by decision makers at all levels. So I think the more we can do, all of us working in this sector, to directly connect young people to our decision makers, the more effective our policy responses are going to be, because that lived experience is going to be central to the thinking of decision makers. But it's got the double benefit of not only does it strengthen policy responses through real lived experience, it helps to combat that feeling of alienation and disaffectedness that young people are describing. Penny, I'm sorry, if you can still hear me, my audio is lost and I cannot hear you, unfortunately. It's saying it's restored, so I'm sorry if you can.
And then
Says it's working.
Okay, now I can hear Paul.
Okay, great. Ours dropped out. It did exactly the same thing.
not quite sure. I'm going to blame the NBN because that tends to be the.
It reminds me, Penny, you'll probably remember this moment when we launched the hub at the breakfast, and certain members of the political people we had engaged in the conversation were sprouting the benefits of the investment being made. And Monique, one of the young people, really talked about how, well, that's all well and good, but do you know what it's like when you have to climb on top of a wheat silo to connect, to get some access so you can actually hear what's going on in your classes, or so you can have a conversation with your counsellor. So I think that's probably a nice little model for what's actually going on out there.
No, I agreed. And in fact, actually, that's what I was saying, I guess, is that the testimony, for want of a better word, that those young ambassadors were able to bring to that launch, I think was really, really significant. And I understand that the work that you've done around the bushfire recovery and engagement with young people has really has had a strong influence from service providers. I think you worked with Royal Far West in producing that report. And so we've heard the anecdotal stories that we're hearing from member organisations and service provider member organisations specifically around that need and desire to engage with young people. It has also been really strong. Are you doing any more ongoing engagement with young people?
Yeah, definitely. That's a key part of our model in terms of how we work. As you know, Penny, we're not a service delivery organisation, so we work in a couple of ways. First and foremostly, we start with the experience of children and young people. So we've got a Young Ambassadors program, which is central to how we do this. And we are just about to release, I spoke about the Living in Limbo and Swimming in Sandbags reports, which were the outcomes and the synthesis of young people's experience through the pandemic. We're about to launch the third iteration of that. So that really helps you to see what the trajectory has been in the lives of young Australians. And we'll be taking our group of young ambassadors who have themselves facilitated a national conversation. So they've gotten around the country and listened to children and young people in every state and territory, in regional and urban communities, and they'll be heading to Canberra as a delegation in the winter session to have conversations about what the perspectives of children are across the country.
That's fantastic. Thank you so much for that work and for the ongoing commitment to engaging with young Australians. It's a wonderful example of, I guess, best practice in this is the work that you're doing. I want to turn now your attention back to the recommendations that we put up on the screen briefly during your presentation. In the work that you've been doing in the advocacy side of things, are any of those recommendations, do you feel like any of them are getting more traction than others? Are there things that are resonating with decision makers at whatever level that might be, whether it be nationally or in a state-based capacity? Are any of them coming through stronger as things that other people are seeing, that it's not just the findings of our report, but other things that are, I guess, connecting with decision makers?
Yeah, I think, Penny, that and largely through the great work of other organisations and leaders in the sector, I think the moment, we may be closer than we've been for a while around the moment for substantial reform in the early childhood education and care sector. I think the work of Jay and the Thrive by 5 Coalition and others who've been really helping to bring this issue to the forefront. I think there's some good progress being made in really framing up both the need for reform and the creation of a system which is truly a system of universal access for young children in that in the first 5 years of life. I think there's some good traction there. I think alongside that, and we've seen again the Business Council of Australia come out this week with their pre-budget submission, where they're quite strong on this area as well, as alongside that the importance of providing support to parents and caregivers for children in those first 5 years of life, and in expanding the provisions of support around parents through paid parental leave, and striving for models of that which are more gender equal. So I think there's some decent traction there. We're seeing, from the Prime Minister and elsewhere in senior levels of government, the continued articulation of a strong focus on mental health and wellbeing. So, and we know that the government has been able to continue to progress the National Children's Mental Health Strategy, and drafts of that have been released, and I think that's positive. I think they've had some really good people around them, with Frank Oberclade and Christine Middledorf chairing that process. That seems to be, from what we can see, moving in a pretty good direction, and I think it's great that Minister Hunt, alongside his responsibilities in combating the pandemic, has been able to keep some focus on the National Child Mental Health Strategy. That's been a significant gap, and as you know, Penny, one of our key pillars is really supporting the resilience of our children and young people, and proper child-focused investments in good support from the very beginning of life, we know is essential there. So I would come back to say some good progress in EC, and let's wait and see where things land in the budget next week on that. And then also in the area of mental health and wellbeing. Nothing is perfect, and still gaps remain, but I would say these are some areas where there is some movement.
Look, I would agree with that, Nicole. And I think for me, in the position that Eracy sits at, one of the things that I think the pandemic has been able to do is put many of the advocating organisations on very similar pages. I think one of the reasons why we're seeing those successes in bringing things to people's agenda has been a greater coming together and agreement around some of those big pillar items that actually need to be addressed. We may have slightly different frames that we bring to those. We may word those asks, for want of a better term, in slightly different ways, but there is a growing consistency around what those pillars actually look like, and the universal approach to a comprehensive system from birth to 5 that's sort of resonating through the Thrive by 5, and that focus on mental health and wellbeing are just 2 examples where I think we've, as a sector, our advocacy has been much more focused as a result of the pandemic, and I think that's only a good thing.
Yeah, and I think, Penny, the Anne Holland's stepping into the role of National Children's Commissioner has been really welcome, and I think the way Anne is really sharpening or government's focus on the importance of thinking about children as the centre of integrated systems is extremely important. Children aren't just little people, mini adults who kind of exist in their own bubbles or float off in isolation. Children are very clearly part of systems both within the family unit, within the community, and at the national level. And again, it comes to this, and I just keep coming back to this point because I find it so fascinating, this lack of congruence between the economic and social conditions that we have at our disposal here in Australia, and the fact that we're in the top third of the OECD comparison in that dimension, but we sit at the bottom third for the outcomes for child wellbeing. And I think again, it comes to this question, well, the clear way to explain that is the leadership and the integration of policy frameworks around that. And I really appreciate the way Anne is articulating that and engaging government about it. And it's why I pulled the slide up from Michael Hogan and Lynn Hatfield-Dodd's work under the Every Child campaign and with ANZOG. I think, again, this is another important tool for how we help to ensure that the investments being made are connecting under a very clearly articulated framework around child wellbeing. And I think until we're able to sustain that level of focus at the national level, sadly, I can't see us moving kind of more quickly out of that bottom third in the Innocenti global report.
No, agreed. And I also would echo your comments around the way Anne has taken on that role. I think it's been absolutely fabulous, and all credit to amazing work that she's done and really what is a very short period of time in that. One of the things I think that we've done as an organisation in response to this issue and this knowledge that has been created, and I think in response to many of the comments that you've just made, our theme for 2021 has been that all policy is children's policy. And we've been trying to take that forward when we've done the advocacy work, and we've been trying to, I guess, articulate that joined up sense of what wellbeing looks like, and therefore child wellbeing is different to adult wellbeing. We need to be really mindful that the contributing factors look different, and that's where things like the Nest and the Universal Declaration have their own sort of role to play in that. And I think this notion of a joined up systems response is particularly pertinent right now, and I think Michael and Lynn's work is sort of bringing that to a fore in a different way than we've seen before. One of the questions has come in from our audience, Nicole, around partnerships between families and schools, and how that work's progressing, and whether you're seeing any of that in the work that you're doing.
Might throw that one back to you, Penny. You're probably closer to that than myself. So because we're not working directly ourselves as UNICEF Australia in schools, so I don't really have much sight of that. What do you have a sense of that?
Yeah, I think the pandemic really forced families and schools, I think, to think differently about what partnership looked like. And I think all credit to our school systems, across the board, both the public systems and independent systems as well, for embracing what was a very, very rapid and swift change to online learning, and to understanding understand doing business different in an online sort of way. It wasn't just delivering classes. I think one of the things that we saw during the pandemic was schools actively looking for different ways to engage with families and different ways to engage with their students. One of the things that we've been particularly proud of here at Eracy, and many of our listeners are probably familiar with, is our real-time wellbeing check-in app called EI Pulse. The way schools have taken that on board, and the way that they've engaged families in why they're collecting that data. And it's not about drawing a picture of what your family is, but actually about giving your children an example of being able of how we can work as a joined up unit, family and school, to maintain the well-being of your child, how we can actually work in partnership. Lots and lots of schools across the country have taken up that opportunity. Lots of schools have not only taken up the use of the app, but then they've embedded Erasey's common approach into the way that they do their business as a school as well. We're seeing lots and lots of those type of partnerships emerging. We're seeing schools do their engagement in a sort of parent engagement, focus on families and how to bring families into the life of their schools in very different ways as well. It's probably a webinar in talking about that in and of itself. So I think, yes, I think it's pushed us to adapt and be innovative in different ways.
I would add, Penny, listening to you, an example did come to mind, and what we've observed is some good collaboration between schools and parents and citizens groups, and we kind of observed a gap in terms of some support flowing. There was sort of strong investment going on at the national level, but limited bottom-up investment being made in helping to wrap the, very bespoke and specific community by community support around children. And we saw, we actually did connect with about 75 schools who were drought, bushfire affected schools, who were feeling the triple impact of drought, fire, and then COVID. And we did see really strong exchange between the sort of the parent bodies within those schools and the school leaderships themselves in trying to determine what the priorities were in those communities for children, their students' activities to support children's well-being, and also some work around sort of strengthening support for those who were affected by the digital divide. So it was very kind of grassroots and bottom up, but it was encouraging, I think, to see some of this practice and exchange.
It's Paul here. I'm just going to read a question that's come in, Nicole, and you guys can work out who's going to answer it. And I'd also encourage people to send their questions in. We can still take some questions. But this question goes to mental health. Why does Australia rate so poorly mental health and well-being compared to other similar countries? 35 out of 38. This seems a really surprising and concerning result, I think, is the missing word on the end of that.
I've certainly got some thoughts. So have you got anything, Nicole, you want to kick off with?
I'll chip in. You please go ahead. Yep.
Yeah, sure. Look, I think the mental health side of things in Australia, and we've had extensive conversations with the team doing the work on the mental health strategy. And we've had some conversations with service provider organisations in this space as well. I think one of the problems that we've got in mental health in Australia is the very narrow way we look at mental health. So I spend a lot of time talking to people about, whether they're a mental health organisation. Am I a mental health organisation? My general response to that often is that you're not a mental health organisation. And actually, if you use that NEST framework, in fact, I actually would say you're a wellbeing, or many of these organisations are wellbeing organisations. So we see it a lot that mental health tends to be the experience where issues are manifest. So it manifests as mental health, but often the things that are driving a poor mental health outcome are actually something that appears in an entirely different domain of that NEST framework. So often we see things that are, material basics. Poverty itself drives poor mental health outcomes. If you're a young person who's growing up in an environment where you are experiencing a real, genuine digital divide, you can't participate in school, or you can't participate in social activities with your friends because your internet is just not good enough and the sound keeps dropping out. Or if you're a young person who is unable to experience health services. I know we heard a lot from the government around the power of telehealth and how we brought that forward with a rapid pace during the pandemic. But again, as we heard at the launch event, that's only good enough if you can actually connect with your telehealth provider, if your internet's good enough. And the way that poor well-being outcomes tend to manifest themselves is as a mental health outcome. So anxiety and stress and depression and all the things that we traditionally associate with mental health, poor mental health, are actually often driven by other factors. And I don't think as a country we stop and look enough at all of the other drivers in the other domains, using that NEST sort of terminology, that are actually driving those outcomes. That's sort of my thinking, and it's certainly something that we're hearing from many of our stakeholders.
Yeah, I think that's absolutely spot on, and I would agree with the questioner's statement of concern around that, those outcomes, and it's one that we've got to keep the focus on. And certainly, again, what young people tell us is what you're describing there, Penny, is, you know, they feel as though mental health is often approached from a very clinical frame, you know, and it's really dealing with the pointy end of mental illness, essentially. And a lot of our services are geared to support, which we need to continue to ensure we are geared to support children and young people who are living with mental illness. But what young people are describing, you know, again, I come back to the young people affected by the drought. You know, they're talking about the effect of adversity and the pressure of externalities on them and their lives. And what I think is really important for us to be able to do is to focus on, as you're describing, ensuring that we've got the conditions in place that support children and young people to thrive, that we are really focusing on early intervention and support, and particularly where children and young people are dealing with chronic stress. But it's also getting those economic conditions in place as well. And again, it's the number one kind of thing that the social and economic researchers from the global team in UNICEF kind of said to us when they were looking at the Australian situation. Number one, you've got to ensure that you're targeting the circumstances which lead to sustained levels of child poverty. And, you know, it's getting those economic conditions in place. And it comes back to one of our first key recommendations, that we've got to ensure that the social and protection environment around children and families is adequate to prevent these other flow-on negative effects.
Yeah, I couldn't agree with you more. I think, and we've had a question come in around child poverty. I think without a shadow of a doubt, you know, measures taken to address the impacts of poverty on children and young people are going to have a significant long-term impact. I mean, we know through other work that Erasie's done, through work that many of our partners, Brotherhood of St Lawrence, other amazing organisations have clearly shown that the impacts of, you know, child poverty almost, you know, reach beyond anything that we can imagine. I mean, they reach into all of the other domains. So we would sort of place that child poverty in that material basics domain of the nest, but we know through the work that we did in to have and to have not, that if you are deprived in that material basics domain, the reaches of that push into your whole experience of life. And we have been part of you know, a lot of advocacy over a number of years around measures to address child poverty. You know, the figures of the sheer numbers of children who are experiencing poverty in Australia are something that, you know, it's not something that we should be proud of as a nation. You know, I guess in the international context, and coming from UNICEF, who works globally, I mean, those figures are probably small compared to some of the nations where UNICEF's working. We've seen that, you know, the government have taken a step in addressing child poverty. They have, you know, put an increase onto the Jobseeker Payment. We also know widely across the sector that, you know, Erasie works with every day, that that's not been received particularly well. It's been seen as far too small a step. One of the things that we've been advocating for, and in fact the work at Kids at the Crossroads informed Erasie's budget submission quite heavily, and one of the recommendations that we've put forward, and we feel really strongly would drive more activity in that area. I think asking for an increase is still important. One of the things that we've advocated for is a commitment by government to report to Parliament annually about how they're actually calculating the figure that is used for Jobseeker, and particularly to be able to report as part of that how they're taking the needs of children and young people into account in calculating that figure. We think that's a small step that could have a significant benefit. I'm just keen to see what you think of that.
Yeah, I think that's a really, really important idea, Penny. And I've just written it down, what you said before, because it's one to remember. All policy is children's policy. I think that is, I think there's no clearer articulation of the fact than how you phrase that. So I think it is critically important that we all continue to advocate for the type of measures you're describing there. Again, many of us in the sector for a long period of time have been looking for an elevated cabinet level minister for children and young people. There's a step, we've got now an assistant minister for children, and that's a positive thing. But again, what we need is that real elevation to the top of tree in government to ensure that simple but extremely powerful statement you've made, Penny, about all policy is children's policy is actually being driven from the very top of government. So I think it starts with leadership. It then continues with an integration of policy framework and picking up the 6 kind of dimensions of systems leadership presented by Michael and Lynn. I think that's a helpful way to think about how to bring this together. And then I like what you described, Penny, in terms of asking for an annual kind of statement of accountability, and you've talked about that from one specific policy piece, which I agree is important. But wouldn't it be great if we, again, could integrate the principles of child budgeting across the Australian Parliament? And each year we had, linked to the national kind of priorities for children's wellbeing, we had an aligned way of understanding what investments were being made and what traction and outcomes and progress were resulting from that. So I think I think that is a critical part of how we continue to close that gap between what the Innocenti report shows us about where we should be. One would reasonably think about the overall prosperity, but we know what an uneven picture it is, and how do we bring those two situations closer to reality.
Yeah, I couldn't agree with you more. And whilst I was starting on the reporting to Parliament on child poverty, that's only a starting spot. I agree. I think a full national statement annually around child wellbeing, how we're going, where we've come from, and what the priorities are for the next 12 months is something certainly to aim for over the next period of time. The time has come to wrap up this afternoon's webinar. I'm so delighted to be partnering with you, Nicole, and with UNICEF. It is a real joy to do this work and to bring information from a variety of sources and put it in the hands of people who are using it every day. And I think that's what I love about the Knowledge Acceleration Hub piece. We are genuinely putting information in the hands of decision makers, of policy makers, of service providers, and we're doing it in a monthly way. So we're trying to keep it as real time as possible, and I look forward to continuing that partnership certainly for the next little while. Thank you for your time. Thank you for your thought in putting together your presentation. It's greatly appreciated, and I know that members of our audience have appreciated it very much. So thank you, and I look forward to catching up with you soon, Nicole.
Sounds good. Thanks so much, Penny. See you later, everybody. Thanks for spending the hour with us.
Thank you.
Thanks, Nicole. Thanks, Penny. It's Paul from Aracy again. Just to remind people that the recording of this webinar will be available, and there'll be a link in our weekly newsletter. You can, if you're not already registered to the newsletter, the details are on the screen in front of you. The next digest is due out this afternoon. So again, I encourage you to rush and get registered for our newsletters if you're not getting it already. People have asked about the slides, and with I'm sure with Nicole's permission, we'll put the slides on our website along with the recording, so you should be able to graze upon those at your leisure. We've got the Grattan Institute up next, I think a fortnight from today. Check again the weekly newsletter, register, check the newsletter, and it'll tell you when the Grattan Institute is coming along. They'll be talking to us about their work to help, particularly to focus on tutors for kids that fell behind during the lockdown and how that's going in New South Wales and Victoria. They made a recommendation to fund a national scheme around that. Victoria and New South Wales have picked it up, and Grattan will in part be talking to us about how that's all going. So our thank you from Aracy, our thank you, Nicole, for joining us today. Thank you, Penny. Thank you, everyone. That's the end of the webinar.